Hello. My QI project is phenotyping the progress note within the electronic medical record. Today in the United States, more than 3.5 billion is spent in the healthcare delivery, more significant than any other country. The United States, the Center for Medicaid and Medicare Services, over the past 2 decades has pushed an increased healthcare technology by providing hospitals and primary care $38 billion to implement electronic health records, or they will be penalized. The bill was implemented to improve quality, safety, efficiency, improve patient outcomes, and increase revenue and cost savings. The healthcare organizations that have implemented the EHR system are finding the cost to implement to be quite costly, and efficiency of use in the systems are not utilized to their potential. Some of the non-utilized areas is the capture of revenue is lost due to the lack of or absent electronic billing within the progress note. The CMMS has required electronic billing as a quality measure, so reimbursement is based off of that. There's power progress notes that include CPTs and ICD 910 codes and coordination enhanced of computerized physician order entry. Delivering enhanced research, risk factors, diagnosis, and required treatment, and pay for performance is the standard, no more fee for service. As you look at this diagram and review the benefits of electronic health record, a good portion shows reduced costs throughout the billing cycles. And then the focus of patient with less days at the hospital, improved preventative care, reduced adverse drug events, and reduced infection rate. So why utilization of EMR to enhance billing? Timely reimbursement frees up more time to spend with the patient. Human error of data entry is removed. Improves efficiency, improves flow of patient within the organization, and decreases administration costs. So you have to decide how you're going to establish to change current EHR and build from that. It needs to be evidence-based data, utilizing 5 rights, clinical decision support system of right information, right people, right channel, the right workflow format, and right points of workflow to assist in building. Then you can use the Six Sigma model to define the goals, which is define, measure, analyze, improve, and control. When obtaining data, the goal is to avoid waste that will reduce time spent with paperwork, eliminate the defects and discrepancies, assess the quality control issues, such as patient safety, patient outcomes, measure data by using data points. Then you have to look at transitioning. What are going to be your obstacles? This is going to be essential. You need to identify the stakeholders because there's usually a resistance to change. Knowledge of the electronic health record system by the end user is important. Overall support of administration for the change. Then we look at how we're going to develop. There's 3 phases: pre-project, life cycle, and post-project. First, the pre-project will identify the stakeholders such as a billing department, providers, administration, and end users. The majority of the time will take place within the second phase, which is the life cycle. This is where I'll build a functional model, develop templates for the progress note to include the pertinent data that is needed for a complete billing note, such as the diagnosis code to each diagnosis, and the capability to assign billing codes. Training will be implemented after the prototype progress note with the electronic data to be built to ensure correct information is being brought forward. Implementation of use will begin after training and reviewing adequate building of the progress note and end user's approval of functionality and ease of use. The post-project phase will have multiple data points to measure for accuracy of the progress note to correct billing codes in actual reimbursement and financial metric? Will total progress notes bill accurately? Did we get total reimbursement? How many of the total were denied? And we'll compare those. It will also measure the stakeholders' input by a survey 30 days to 60 days out of using new electronic billing templates for needed changes. And then that is the last phase of your Six Sigma is change what you've already done and then continue to control the different changes. So then I looked forward to the future. Where would this take us? And after reviewing research that was done by Vanderbilt University, there could be an admission navigator that would develop the codes, the billable CPT code, and then it would populate, for instance, it would populate for risk factors that are within the progress note, asking, do you need to get this medication because this person has this diagnosis? Um, so utilizing the billing codes and the multi-components, such as documentation and diagnosis codes, results in improved, consistent, and higher performance than single component measures. Overall, progress notes and ICD-10 show significant higher results having these two components: increased identification of risk of disease, and markers would require more follow-up with patient care. The clinical progress notes provides the best overall data to acquire patient history. It will alert for possible new diagnoses and becomes part of the permanent medical record to share globally. And as you're building this, keep in mind that it's going to be volumes and volumes of change. And I brought this cartoon in to relook at that as an ending note. And hope you enjoyed this presentation attached as my references. Thank you.